Hi everyone, Dr. Daniel Shanahan here again from Legs, Foot and Ankle Associates. Thanks again for checking out our latest YouTube video. As always, make sure you receive our latest content. Subscribe by clicking that button below. Hit that bell icon to receive our notifications. And if you have a question you want answered, leave us a comment. We will always get back to you. This is the fourth video in a series of videos addressing foot pain. Our first video, we went over general foot fatigue and achiness. The second addressed ball of the foot area. With pain to that area. The third covered nerve pain issues, and you can find all of them on our YouTube channel. In today's video, we're addressing the topic of pain to the midfoot and rear foot region, near your arch out to your heel. The area around your arch and further back is what we call the midfoot and rear foot. Crazy thing is, this area consists of only 7 bones. However, they all interact with each other in very complicated joint anatomy and, of course, lots of ligaments, tendons, and other structures in this region. And they all have to handle the stress placed on them when we use our foot and ankle. Certainly the most common pain issue to the midfoot or rear foot region has to be good old plantar fasciitis, or pain to the bottom of the heel. This is a problem with a big, thick ligament called the plantar fascia that begins on your heel and spreads up into the ball of your foot. It's the biggest, thickest ligament in the human body, and it can cause a lot of problems. However, there are also multiple tendons that course all around the foot and ankle, in the front, the sides, and the back, that can all develop painful issues. The Achilles tendon is the biggest, on the back of the leg and the heel. It's the largest of this whole group, and it has a set of problems that can develop, ranging from simple tendonitis up to the devastating injury of an Achilles tendon rupture. But there are also tendons that support the arch that can have big problems, tendons to the outside of the ankle that can have issues, especially after an ankle sprain. And that in itself is a common problem with the midfoot, rear foot area. Ankle sprains can involve multiple ligaments around the ankle and even lend themselves to cartilage damage within the ankle. So as you see, there's a lot that can go on, and it's very complicated in that area. The joints in this region are especially complicated with the way they all interact and are prone to developing arthritic issues as we beat up our feet and add on the miles. Really, if you stop to think about it, the midfoot, rear foot area is truly remarkable anatomy. The fact that you have all these bones, tendons, ligaments, nerves, blood vessels making a 90-degree turn at the ankle level to help us ambulate and do what we do, it's truly amazing. We don't have more problems with them. The good news is we have a lot of ways to help you deal with the pain to your midfoot, rear foot area. It all begins with an in-depth clinical exam that may include x-rays or ultrasound right here in the office. Then we will formulate a comprehensive treatment plan to solve your issue as quickly as possible. This can involve a plethora of options we have here at the office, from simple topical medicines to orthotics, bracing, immobilizing boots, sports medicine tapings, injections, laser therapy, and sometimes surgery. So if you develop pain to the midfoot, rear foot area, definitely do not shrug it off as just sore feet. There's a lot of complicated anatomy in this area that can develop troublesome conditions. Dr. Petronell and I are here to help keep you moving with happy, pain-free feet. Call us today, schedule that appointment, and let us help solve your painful issues quickly and efficiently. Thanks as always for watching. I hope you learned something, and please remember to subscribe below and hit that bell icon for notifications. If you have a question you want us to address, leave that comment below and we'll get back to you. We'll look forward to seeing you next time. Have a great day. Dr. Daniel Shanahan here.